We are talking all things restless leg for you throughout your pregnancy. We have all the tips and tricks that you can use, whether or not something works for you, something else might work for your friend. We have them all. And so try them all out for your needs while you're going through this.
And in this video, we're going to go over all of our go-to stretches, exercise, products when it comes to restless leg, but stay tuned because there might be some more coming forward.
First things first, we're going to talk all about electrolytes. So you need electrolytes in your diet because there is a difference between salt. So your iodized table salt, throw it away. You don't need that anymore. Add in Himalayan salt, it's the pink salt. Add in Celtic sea salt into your diet. Add a little bit more on your eggs if you want to. Just get rid of the iodized salt when you're pregnant especially. And then add in your electrolytes. These are LMNT and they are absolutely amazing for the cellular processing to decrease fluid in your bodies. And so when it comes to restless leg, you might have an increase in fluid that we want to decrease.
And this increase in fluid, so we only have so much area to work with in our body. So that fluid has to go somewhere. When there's excess of fluid, because you're growing a baby, it has to go somewhere. And so when it goes into the legs, it starts to compress down on a nerve. When a nerve gets compressed, it gets really upset. When a nerve's upset, you get tinglies, maybe some cramping, right? It can't get those signals out. So our goal is to reduce that swelling through hydration. We want to pull that water that's around your leg and around the cells back into the cells, so that way we can get some pressure off that nerve. And great thing with LMNT and adding that salt in, you also pee less. And so anyone that feels like because of pregnancy they're peeing all the time, and you might be drinking all the water in the world, which is fabulous, keep doing that. We want to pull the water in. We want you to keep that water inside of you. Keep yourself hydrated.
So add in your LMNT. And this is also really great because it has a high amount of sodium, potassium, and magnesium, all three you need for your cellular processing. Next thing that we're going to go over is your elevation at night or throughout the day. So Dr. Evie's going to lay down here so we can demonstrate with our knee pillow. She's going to lay back. Feet are going to be above the heart just to help with that fluid to go out of that legs, decreasing that compression that we were just chatting about on that nerve. With that, you can certainly get your partner to help you out with the massage. And so you're just going to take your hand and literally rub towards the heart, trying to get that fluid to go back towards the midsection of the body. You can go all the way down the leg as well, but my favorite thing to do is to use magnesium lotion. So this is our Earthly Wellness Good Night Lotion. Has magnesium chloride flakes in it. If your restless leg is causing your muscles to cramp and everything like that, you need some sort of magnesium lotion on hand to place on your legs. This can be a really nice way to help those muscles just relax and get the fluid out a little bit easier when they are functioning properly. So, one thing I like about this is you only need a little bit. You don't need to use a lot of it. So, we're just gonna pull out Abby's. So, massage it in and literally just work it into the muscle. You're just gonna go straight up.
And so for anyone that's later in their pregnancy, so we're talking maybe like third trimester, belly's getting a little bit bigger, you might be worried about laying on your back, right? So when you're laying on your back, one, a partner should always be with you in case we're experiencing any sort of dizziness, especially with going to that up and down position. You only need to be here for about 30 seconds or so. Get that motion going, and then gently, with the help of someone else, coming all the way up and swinging down. Or for later in pregnancy, when we're on our back, someone's here, we roll to our side and bring ourselves all the way back up. You don't have to hang out there. Don't sleep in that position by any means, but just allowing yourself to give your body the time to bring that fluid back.
When you are laying on your back as well, you can certainly pump your feet back and forth. So Dr. Abby, go ahead and pump your feet back and forth. This movement will also help get those muscles activated, get that fluid flowing out of your leg and reducing that restless leg syndrome that you might have.
Okay, so you guys saw what that foot pumping action looks like when we're on our backs in that supine position, but another great option for standing, right? Maybe you're uncomfortable getting on your back, maybe you're just by yourself, or you're in the middle of your workday and you just need to kind of work things out a little bit. A great option is a standing calf raise. So Dr. Jess is going to show you a standing calf raise. please make sure that you have a wall with you, right? We want to make sure that we're taking core and balance out of the equation. Dr. Jess is showing 2 feet, so we're rolling up onto the first and the second toe, and by activating those calf muscles, we're getting that muscle to work. By the muscle moving and activating, we're kind of pumping that fluid in and out, trying to get that fluid movement occurring. You can also just take it 1 foot, right? If you're like, it's only the one side, maybe you take it 1 foot on this one. And then a great option to do after that is to stretch it out. So by taking that foot against the wall, Dr. Jess, yes, you're just gonna lean into it. Look at that, now you stretch it up. Activate it, stretch, ready to rock and roll. When it comes to restless leg, another great option. We've talked about elevation, we've talked about hydration, talked about compression's another great option, especially for the travelers out there. You gotta get some compression socks, and there are different levels of compression, so make sure you find a pair of compression socks that really work for you. The different grades, please consult with your other physicians about what that looks like for you.
Different brands.
Yeah.
There's do brands out there too that may or may not be great, and so again, talk with your provider as well to see what works best for you.
With the goal of compression being, we don't want the fluid to be pulling in the feet, because as we talked about, right, when there's excess of fluid and it compresses on that nerve, it's going to send different signals, and when we get the different signals in the nerve, we get those tingly sensations. So by having the compression socks on your feet, it's going to help to keep kind of that fluid out, kind of push it all the way back up and encourage it to not pull down where your nerves are, where your feet are. That is what we have for Restless Leg for you, at least today. So number 1, subscribe.
Yep.
Because we always have content coming out, and there could be an update to our Restless Leg that we want to make sure that you know. And second,
if you have any comments, just leave them in the comments below.